Hello everyone! Welcome to OET Answers. The terms continuing care and continuous care are commonly used in OET writing. Many candidates are unaware of the proper usage of these terms, and they interchange the words. The term continuing care means that if a patient is transferred to another place and gets the same ongoing treatment, they must continue it. There is no specified time and date for the treatment. The patient must get the same care till recovery. We can replace the term ongoing with continuing care. Usually, candidates get confused with the word continuous care. The term continuous care is used in a hospital setting, which means a patient is admitted and giving continuous care for 24 hours. In this context, you can use continuous care. We have to use the standard form continuing care or ongoing care in OET letter writing. So if you interchange the terms, it can change the whole meaning of the situation. If this video was useful, please subscribe to OET Answers